Welcome back to the report. The South African government has announced that a travel ban would come into place between itself and 3 Ebola virus-afflicted countries. The outbreak has so far killed 1,200 people in Guinea, Sierra Leone and Liberia in West Africa. Nathaniel Amos-Sansom has been following the story.
The Ebola crisis in Africa continues to deepen as South Africa, the continent's largest economy, imposes travel restrictions on the 3 affected countries. The country's health minister stated that the restricting of travel to and from Guinea, Sierra Leone and Liberia was the best way to guard against the virus.
A total travel ban for all non-citizens traveling from these high-risk countries unless the travel is considered absolutely essential. For citizens of South Africa who wish to travel to these countries, they will be requested to delay their travel unless it is also absolutely essential for them to travel to these countries.
The impact of the virus is being felt across the African continent. In the neighbouring Ivory Coast, all air and land borders have been closed with the affected countries. Many people fear that even if Ebola doesn't arrive in the country, its economy will be hit hard.
En tant qu'agence de voyage, voir qu'il y a une restriction au niveau de nos activités, ça nous a vraiment créé un choc puisqu'on n'est plus à mesure de pouvoir satisfaire notre clientèle. Vous imaginez des clients qui doivent venir ou qui doivent partir, qui du jour au lendemain voient toutes leurs réservations être annulées à cause du fait d'Ebola. À notre niveau, c'est vraiment un choc émotionnel. Et vous imaginez que ça va avoir une répercussion sur le plan financier, parce que notre chiffre d'affaires va certainement prendre un coup.
Ebola is a hemorrhagic disease which can kill up to 90% of those it infects. In the current outbreak, more than 1,200 people have so far died in the 3 small West African countries that have been affected. The virus is also feared to have gained a foothold in Nigeria. Many Western aid workers have also become infected with the disease, sparking fears that the virus might spread beyond the African continent. Yesterday, African aid worker Dr. Kent Brantley became one of the few people to have contracted the disease and survive.
Today is a miraculous day. I'm thrilled to be alive, to be well, and to be reunited with my family. As a medical missionary, I never imagined myself in this position. When my family and I moved to Liberia last October to begin a 2-year term working with Samaritan's Purse, Ebola was not on the radar.
While health experts maintain that Ebola will not become a full-blown pandemic, many fear that the virus is damaging the economy and society of a region which has suffered instability in the recent past. Overcoming the legacy of the outbreak will be one of the region's main challenges in the future. Nathaniel Amos-Sansom, Islam Channel.
Now to discuss this, we have James Schneider, Chief Editor of Think Africa Press. James, now the Ebola crisis over the last few weeks has gripped us all. 1,200 people have already died. How necessary are these travel bans?
Well, it depends where the travel bans are too. So it's different to neighbouring countries as it's flying to countries further abroad. So to South Africa, the logic is clearer, but say Senegal have now closed their border with neighbouring Guinea. And there is a pretty strong argument that closing that border may make the travel less easy to screen, less easy to see, if that travel is necessarily going to be made, which is likely to be between neighbouring countries. To a country like South Africa, where really the only way to get there is by flying, it's a really long distance, then you can more see the argument.
So what does that mean for people who are trapped in these countries?
Well, I mean, the majority of the populations of the 3 most affected countries are not going to be, engaging in international travel anyway. I mean, we really should be much more focusing, I think, on how the domestic healthcare system is able to deal with the populations, and also how the governments are relating to their populations. There's been a slightly worrying turn this week by the Liberian government, sort of almost against its own population with respect to how it's carrying out its quarantining for Ebola.
Now, Liberia is one of the worst affected places. I've heard that there's a humanitarian crisis now taking place.
Yeah, so earlier on this week, there was an area of Monrovia, the capital, West Point, which is a very, very poor slum with very, very bad health indicators already. There's no public toilets. It's that sort of situation. There's 75,000 or so people live there. And that Ebola centre was attacked by local residents who already don't really have a very good relationship with the government or a very good relationship with foreign health workers or that sort of thing, to take people out. And in response, the government set up a curfew, which it didn't early on Wednesday morning, which they didn't announce to the population. So the population of this already poor and struggling part of the capital woke up to find that they were being shut in a quarantine of 75,000 people, and they responded through protest and through riot, and the military responded, and 4 people were shot, live ammunition was used, and 1 teenage child was killed. And this is very worrying, but also if they're shut off from the rest of the capital, then what they're going to eat and drink becomes a really big problem, especially given that today in the Liberian press it was reported that some of the rice that they're being given is rotten. So it's not only just a straight health issue, it sort of mimics some of the relations that happen between state and society, which then are going to feed into questions of health that is not to do with contagious disease, health which is to do with nutrition, to do with hydration, and also to do with normal infectious diseases like malaria.
So what sort of assistance is being provided by the international community?
Well, there's rather a lot, and it gets stepped up all the time. The WHO is obviously very much involved. International NGOs like Médecins Sans Frontières, countries are worried about it, and they're paying, obviously much more attention to the healthcare systems of Liberia, Sierra Leone, and Guinea than they would do ordinarily. But it really must be stressed, I think, that it is the governments of those 3 countries, not that they must be the ones that carry through everything out, but for things to be most effective, the populations must consent to the way in which the government is acting and the way in which Ebola is being treated and quarantined. And that can't really just be done through external funding or through external support. I mean, there are things that can be done, sending more rubber gloves, for example, more disinfectants. Simple things like that will very much help. But fundamentally and structurally, it has to be about how the government is relating to its people.
Okay, one of the other things that I saw were neighbouring countries like Chad, which borders Nigeria, were allowing some refugees in. Have other countries responded like this? And if they haven't, why not?
Well, the Chad, Nigeria is separate. They have lots of refugees, but that's from people being displaced by Boko Haram, not from Ebola. Countries that neighbour the Ebola countries will be loath to accept too many people, and there's been more of an attempt to kind of close off and quarantine areas and erect pretty much roadblocks so that people from affected areas can't get into more population dense areas. It's a slightly different situation to most humanitarian situations where people are trying to get out, and it's about giving support in neighbouring areas which had no idea or limited idea that they were going to have to be providing something. This is much more about dealing something in as localised a place as possible.
One of the things that I saw was, again, going back to South Africa, that some of their nationals weren't actually being allowed in had they travelled to any of these countries.
The South African nationals weren't being allowed back into the country. I haven't seen that. My understanding is that after screening, they're allowed back into the country, and it's non-nationals that they're not letting in. But that might be a new thing that I haven't yet seen.
So how should these African Union nations and the local and neighbouring countries be reacting to the Ebola crisis? Because we know it is growing.
It is growing. I mean, in the whole. Sierra Leone, Guinea and Nigeria have responded pretty well, given the circumstances, given their conditions. Nigeria especially. I mean, if Nigeria, that spreading would really set off some pretty worrying things. And every single case that they have had has been related to their patient zero, Patrick Sawyer, this Libero-American man who flew in to Lagos when he was sick. So in some ways they are coping very well, but I mean, I think it has to go back to what I was saying beforehand about making sure that there is consent among the local populations. I mean, everyone pretty much knows the things that need to be done. I mean, it's to do with basic hygiene, it's to do with disinfectant, it's to do with limiting contact with people who are sick. And if you do that, you can halt the spread quite effectively, but this needs to be done with the understanding and the consent of the populations, and I think that's really the real challenge in some states which tend to have a reasonably authoritarian relationship with their populations.
One final question. Nigeria, a flourishing economy, how will this impact their economy?
Well, we're yet to see what's going to happen, and probably if it stays at the sort of level it's been at now, it's going to be okay. It might have a small blip, but the fundamentals are all there.
Okay, well, thank you very much, James, for joining us. Unfortunately, that's all we've got time for in tonight's programme. I want to thank all of my guests, James Schneider, Mohammed Amin and Mohammed Dilwar Hussain. And thank you at home for watching. Remember, you can keep up with the Twitter conversation on all of tonight's stories using @IslamChannel and @IslamChannelCA and the hashtag #TheReport. We're back on Monday at the same time, but for now, we'll leave you with some scenes from an Icelandic volcano where locals are bracing themselves for an eruption after 3 big earthquakes shook the area. The aviation industry is readying itself for potential disruption on the scale of another similar incident in 2010. The incident shut down Europe's airspace for 6 days. Until Monday, good night.